And we're back now on Alive and Wellness, talking with Dr. Carolyn Dean. I want to take a moment at this point in the broadcast, as we usually do, to tell you that we don't officially endorse any of the methods or practices that are seen throughout our show. You know, if you should choose alternative treatments, we hope you'll use common sense. If you have a critical, recurring medical problem, be sure to consult your doctor first. And as we said, we're talking with Dr. Carolyn Dean. She's the author of the book, Complementary Natural Prescriptions for Common Ailments. The common ailment we're talking about now is called candidiasis, which is yeast infections, which many of us have been plagued with at one time or another. Our phone lines are open, 1-800-988-TALK, 1-800-988-8255. We'll take your questions. In fact, we have one waiting. But let me make that point, Dr. Dean, about birth control pills and the connection.
Yes, taking the birth control pill means every day a woman takes a hormone, and that hormone can initiate more yeast growth. So, as I was saying with antibiotics, if you eat yogurt or take acidophilus, then you can balance that out.
Okay.
It's simple. But I have seen women who haven't even been able to sit down from the pain of vaginitis.
Yes. From
birth control pills.
As a result of just constantly taking,
yes.
And kids can get, here's an important point, ear infections.
Right.
This is a form of candidiasis.
Yes. My worst case was when an 8-month-old infant came into the practice and had 10 sets of antibiotics in its short 8 months. It had been born, the baby had been born to a mother who had vaginitis at birth. So coming through the birth canal, it appeared that the child got a yeast infection in the ears. Now, it was misdiagnosed at birth as a bacterial infection. So the infant was put on antibiotics. And it continued and continued.
Made the cycle,
Yeah, you take an antibiotic and things can settle down because the body sort of suppresses everything in order to get rid of the antibiotic. A week or so later, the child gets irritable, cranky, the ear discharge starts, you look in the ear, well, I guess it's an infection.
So what do you do for that then?
Well, what I did was ear cultures, found it was yeast, no more antibiotics, and give the child acidophilus and do all the things.
How do you give a small child? How do you?
Well, this is under a doctor's supervision, of course, but there are infant formulas of acidophilus, and children eat yogurt too, plain yogurt.
So you see a physician for that kind of hopefully a homeopathic one. We've got a phone call, I think, on the line. Wendy is calling from New Jersey. Wendy?
Yes, hi.
Good
My
morning.
mother's had constant burning in her urethra, and she's tried everything from acupuncture to azogastrins and all different types of things, and nothing is relieving her problem, and she's miserable.
She said she's got constant burning around her urethra. Did I hear you correctly, Wendy?
Yes.
Yeah, it's her mom.
Yes.
She's wondering if there's an alternative here. You think that might be related to yeast?
It's possible. It's quite possible, and to find a doctor who would help make a diagnosis, you can get a yeast culture as well. I didn't mention that, but a yeast culture around the urethra, and even looking into some of the things we're talking about, eating garlic, avoiding dairy products and sugar, changing the lifestyle in that way. Cotton underwear, synthetic underwear.
That's always been, I've always heard that's important, Why does that matter, the cotton underwear? Air going through the cotton fibers instead of synthetic.
Instead of synthetic, which retains the heat and the moisture.
Same with pantyhose, right? For women, you have to remember. Now, you touched on these solutions, ways to try to change our lifestyle so that we can hopefully avoid some of these problems. Let's go a little more into depth. You mentioned garlic.
Yes, garlic is an antifungal food. A person could eat that, put it in their diet, and that would help kill the yeast in the intestinal tract. In the beginning, when I have treated people with candidiasis, I have them avoid sugar, dairy products, and wheat products for several weeks, and see if that makes a difference.
Wheat. Boy, that's a lot. That's a lot out of our diets, isn't it?
Well, most people are eating those things 3 meals a day, but there's millet, there's rice, there's rye products. For dairy, there's so many soy products now that take the place of dairy. And sugar, I don't necessarily say to go to the the sweeteners, but just try to cut it back.
Just cut it back, diminish your use of it a little bit.
Because what happens over time is you lose your taste buds. you sweeten things or salt things too much,
and you need
don't,
more and more, don't you?
Yeah, you need more and more. People find if they avoid these things for a little while, then when they have a treat, that it tastes so much better to them.
That makes sense, yeah. By the way, stay tuned because we've got some interesting garlic recipes today. Since we're talking about that, we're going to be showing you how to cook with garlic, so that can help, I think. Yeah. Sherry's on the line from California. Good morning.
Good morning. My question is, I have diabetes, and seems like for the past 6 or 7 months, I have been treating a yeast infection, and it seems to get a little better, and then it seems to swing the other way and get really bad again. And I just have no idea how to go about getting it treated, you know, once and for all.
Yeah. Well, that's a perfect example of sugar affecting yeast, because when a person has diabetes, their blood sugar level is elevated. So in diabetes, it's important to keep the blood sugar under control. And then a person with diabetes might have to take a herbal drink on a daily basis, like Lapacho tea.
Lapacho tea, never heard of that. Is that in health food stores?
In health food stores.
Okay.
It's a tree from Brazil, and it's the bark of this tree, and you can't grow funguses on the bark, so the people realized it would be good for yeast and molds.
Lapacho tea, one more new thing to learn then. This is Dr. Carolyn Dean. We're going to have to stop it right there, but we'll have you back, I hope. The book is called Complementary Natural Prescriptions for Common Ailments. Hope you get a handle on those yeast infections as a result. We'll be right back in a moment.